Hi there. I'm here to talk to you about my quality improvement for the practice I would like to have after graduation. I currently have clinical on 10 West at Children's Hospital in Tosa, and I've applied for a night shift position here, and my dream would be to be a pediatric nurse after graduation. So that is the area that I'm focusing on for my quality improvement. And my improvement is consistency of cares that are offered. And these cares include oral hygiene, gown changes, bed and linen changes, as well as proper glove changing and hand washing with diapering or other incontinence, as well as cleaning and flushing IV lines. And I feel that these cares are very important for all patients on any floor, but especially at Children's Hospital, there can be a disconnect between the nursing staff versus parents for what is being performed. And I think this especially relates to oral cares, which should be performed twice daily. And sometimes parents are doing it, sometimes they aren't, as well as linen changes and gown changes, as well as diapering. When diapers are changed, there should be proper hand washing in between, and gloves should be changed and hands washed prior to any further interventions by nursing. And lastly, making sure the IV lines are flushed properly and that uh, there's cleanliness with the IV lines. So this implementation with consistency of care, it involves talking with the parents and it has been proven to improve patient outcome to have consistent cares and proper communication. Especially some parents may not be able to be there every day. So even them just knowing my children are cared for well while I'm gone. Or if the parents are in the room, you may not want to disturb them or interrupt them, but verifying that they did these things, like, or offering the gown and towels. Maybe you're not the one who bathes the child, but knowing that it was still performed and you offered them the tools. They may not know that they can take a bath whenever at any time of the day, or that maybe they forgot their toothbrush and they didn't realize the floor had extra toothbrushes. This will affect all members of the care team. It most directly will affect the nursing assistants, and the RNs who provide the majority of care, but all members of the care team have the responsibility of providing care to the patient. And especially with OT, if they're working with someone post-op, they may be the ones that they want to assess if the child is able to brush their teeth well, if they're able to walk to the bathroom, if they're able to get dressed on their own. So just making sure that it's documented that these were done, even if it's OT that's doing it instead of the nurse. So the overall cost of this intervention, there will be a need for an increase in nursing assistants to ensure there's proper staffing. As well, and then the implementation would be prioritizing the completion and documentation of these cares. One way that may help with this is putting reminders on computers or shared spaces. I've seen little stickers in the corner that will say I/O question mark for input output to ensure that you're marking that input and output each day. And I think that I've seen this as well for oral cares. In each bathroom on the med surg floor that I am an extern, in every bathroom it says oral hygiene by 10 a.m. question mark. So, or that is the gist of what it says. I do not recall the exact phrasing because it's in patients' rooms, but this is to remind staff that every day we should be offering oral cares and it should be documented, as well as the patients. They're going to feel off being in the hospital. Maybe they don't remember if they brushed their teeth yet, but seeing this sign and being like, oh, I haven't done that. I should brush my teeth today. It's different being in a hospital versus being at home. So how to measure the success of this? I feel that you can use auditing through Epic to ensure that each patient, it is documented each day on each patient. And I feel that this responsibility will fall on the nurse. The nurse can delegate this task to the aide, or any member of the team. So if she has a nursing student, or if she has another type of technician with her, or if OT did it, and just ensure that it can be delegated, but ensuring that it's documented properly. And if this is undocumented, share this with the nurse and continue to monitor. And if it's consistently not occurring, there should be further action, such as additional training or some type of maybe a reward system for those who are at 100% completion. I've seen this with Epic auditing for pain reassessment on the floor that I am an extern. We have weekly reports, and every RN, or they also do the externs as well, that they measure the percent completion of pain reassessments. And if you reach 100%, you get a shout out in the weekly announcements. And it's a fun way to, you have pride that I'm being consistent. I'm making sure I'm reassessing pain. This is a priority of my floor and I'm prioritizing it. So I think there are ways to encourage compliance with this new intervention. And lastly are my references. So this article really dug into the quality improvement that occurs when with offering cares and discussing this with families. So thank you for your time.